This is an alarming study. If you take a group of individuals and you limit them to less than 6 hours of sleep, and you were to check their insulin sensitivity after just 3 days, clinically they would show pre-diabetic. Because poor sleep has been associated with insulin resistance and therefore reduced insulin sensitivity. If we look at metabolism and weight, individuals who get insufficient sleep are at significantly higher risk of obesity. They develop something called leptin resistance. So the brain can't receive the signal of I'm full. The ghrelin levels goes up, and so they feel more hunger. REM stands for rapid eye movement. Individuals who don't get enough REM sleep are at significantly higher risk for anxiety and depression. So that's one of the important reasons why we need to drink. If someone says, I don't drink, that's concerning. Caffeine works by blocking adenosine. Caffeine, even if you are asleep, can still be affecting your sleep. We often hear, I can have an espresso and all right to sleep. So be careful. Your sleep could probably be better if you didn't do that.
Dr. Jeeten, what is one thing you see people doing that's super common, they don't realize it, but it's destroying their sleep?
Well, one thing for sure is that individuals are struggling to have a bedtime routine, something to do to unwind. We're all programmed to just go, go, go. And we're throughout the day, up to bedtime, we're just getting that constant stimulation. But our brain is not wired to go from a stimulated environment to sleep. It requires a transition. Just like an airplane that's flying can't just immediately land, it needs to start that descent. And therefore, that is something that we need to be stressing more. Everyone should start the process of sleep about 90 minutes, ideally, before their intended bedtime. That can make a huge difference to help increase sleep quality, the depth of sleep, and the overall restorativeness of that sleep.
Okay, so 90 minutes. Let's walk through an example, what somebody would want to do starting that hour and a half out all the way to bedtime.
Great question. So lighting can make a big difference, right? Most of us at this point have probably heard of blue light. What makes blue light so dangerous is that it's going to suppress melatonin. And we need an abundant amount of melatonin in the brain to be released in order to send the signal to the brain that we need to switch to sleep mode. And so we need to be cognizant of how much light we're getting in that 90 minutes, but also what is the hue of that light? Is it bright white, which is going to have more of the blue light spectrum? What kind of bulb are you even using can make a big difference. Some bulbs have way more blue light. And so dimming the lights, having a more yellow or red hue is ideal, and limiting the stimuli. So whether that be whether that stimuli, in addition to light, could be activity, physical activity. We need to slow down, and then doing something that can be relaxing for yourself, the mind, and that can vary person to person. So it's important to identify what that might be for you, and ideally, it's be outside of electronics.
Okay, so you made that connection there between light and melatonin. How much light does it take to ruin that production?
Not much, actually. Just as little as 100 lux. Okay. Now, just to give you an idea, if I'm out on a bright sunny day, how many am I getting? Probably about 100,000 lux. And if I'm by a window indoors, even on a cloudy day, it can be a 10,000 lux. Okay. So as little as just 100, a fraction of that could be enough to suppress the release of melatonin.
While we're on the topic of melatonin, what do you think about supplementing with that?
So it's very commonly done. Melatonin actually doesn't function too well as a sleep supplement. You see, melatonin's job is not necessarily to induce sleep. Its job is to communicate timing of sleep to the brain. And so That's why if someone's just taking melatonin and expecting it to induce sleep like a sleeping pill, they may often find that it just doesn't work that way. Um, its job is to time the circadian rhythm, which is that internal clock within our brain, and cue it so that clock is firing at the same time at predictable moments throughout that 24-hour period.
So, what would you say would be a good use of it as a supplement and then a bad use?
A great use, I do it personally, would be to treat jet lag, right? Because I'm crossing different time zones now. My brain is trying to figure out what time is it actually. And so if you then took that melatonin about 2 hours before bed, or even 4 hours before bed, you that brain is going to determine what time it is, and it can make a huge difference, especially when you're crossing more than three time zones.
Okay, so somebody that's going to use it as a tool when they're traveling, how much?
Small doses. I'm seeing individuals are using entirely way too high of doses. I'm seeing doses 10 milligrams, 20 milligrams. And the studies on melatonin were actually done at just very low, zero point 0.3, zero point 0.5. That's all it takes to entrain that circadian rhythm and set the clock. And so actually higher doses above 5 milligrams can actually worsen sleep quality and worsen the brain's ability to determine what time it is. So if you do choose to take melatonin, I would say low doses, zero point 0.5 to 3 would be my maximum dose.
And for somebody using that again as a tool periodically, any question whether or not that can suppress our own production?
It can. Melatonin is a hormone. And it's important because it's going to behave just like any other hormone within the body. So, for example, if I'm taking exogenous cortisol, okay, meaning just say injecting cortisol every day, my adrenal glands are going to suppress its own production of that cortisol through a negative feedback loop. Likewise, if my pineal gland, which is what's storing and releasing the melatonin, if it's seeing that there's enough melatonin already out there because I keep taking it orally, it will reduce its production because it doesn't need to produce the melatonin. It's already there. And that's not ideal because now when you try to fall asleep independently of melatonin, there's not enough in the brain, and therefore sleep is going to be harder to achieve for that night.
When it comes to light impacting melatonin, our own production in a negative way, is it only light through the eyes, or do we need to be protective of the skin as well?
The main one is through the eyes because there's a pathway straight from your retina. It goes straight to the suprachiasmatic nucleus, which is that internal clock location within the brain. And that one is by far the most potent.
What are your thoughts on blue light blocking glasses? You mentioned changing the lighting in the house, but if somebody's in a situation where they can't do that, do the glasses have any benefit?
So I have a lot of patients who have to work on their computer. They have to work late at night. And so blue light blocking glasses absolutely can help in those individuals. Because now when they put the glasses on, those blue lights getting blocked, of course. I want to caution here. There's different types of blue light blocking glasses. We see some that have the clear look and some have that red tint. The red tint really is superior. It tends to block up to 10 times more of that blue light than the clear one. So I would purchase one of those and then use it, especially if you're working on your computer within 90 minutes of your intended bedtime. Definitely helps.
What about on the other end of the spectrum, getting enough good light during the day, specifically in the morning, and then what that looks like?
So there's a term I want everyone to be familiar with. It's called Zeitgeber. Okay, German derived word. And a Zeitgeber is basically something that's going to cue the brain that this is a time I'm supposed to be awake. And so light is by far the most potent Zeitgeber. And the timing, if you want your brain to know 7 a.m. is a time I should be wide awake, then bright light exposure at 7 a.m. absolutely would be the way to go. And it doesn't take too much time. You don't have to go outside and spend an hour. Even as little as just 10 minutes in the sun can be enough to entrain that circadian rhythm and get you wide awake.
For somebody that's on a different schedule, say they're leaving the house in the morning really early before it's light, what do you think about these lights that you can get in the house to replicate, at least somewhat, what you'd get from outside?
Those light boxes, they can emit about 10,000 lux. Now that's quite a lot because remember, it only takes 100 to have a significant effect. So they absolutely do work, especially like individuals in the winter when it's, of course, very dark. Light boxes, they do work. Even just turning on your lights in your home bright in the kitchen. Kitchen is always one of the brightest parts of the home. So wake up, just turn those lights on. Use your dimmers in the evening, not in the morning.
So you mentioned Zeitgeber, a new word I'm sure for many, and light being the biggest one. What other ones are at play though, secondarily?
Yeah. So physical activity. So no, you're moving around. So if you're moving, you must be a time you should be awake. And so working out in the morning is a great way to adjust. If you're traveling, you crossed 8 time zones and you want to adjust quickly, doing a morning workout is a great way to help adjust. Other potent Zeitgebers, food, actually. So this is why it's really important to try to eat around the same time every day, right? Individuals who I just eat when I'm hungry and their eating pattern may be all over their place. Their circadian rhythm becomes again less predictable and they actually might struggle to fall asleep at a predictable time or wake up at the same time every day. So that's another very important Zeitgeber.
Okay, tying to the food piece and its impact there on setting our internal clock, how do you feel about fasting? Somebody skipping breakfast or skipping, say, the last meal, compressing that eating window, and then in that case, we're not going to be providing that input to the body. So how do you feel about that?
Great question. So fasting has many benefits, okay? Um, and I think the eating window is very important. Now, what that eating window could be, it depends what the individual's goal is, right? If they are trying to advance their circadian rhythm, what that means is to get their body to habitually wake up earlier and go to bed earlier. They may actually benefit by having an eating window that starts pretty close to their awakening. So in that case, eating a breakfast, maybe eating an early lunch, and then skipping the dinner. Now, if someone's trying to delay their circadian rhythm, it might be beneficial to maybe skip breakfast and then eat a lunch and maybe an early dinner. In general, though, it's not recommended to eat too close to bedtime. And this would apply to most individuals across the board. So generally 3 hours is when we need to have cut our food intake by, because not only can eating affect the circadian rhythm, it can you're starting the digestive process, which means then for the next 3 hours, the quality of that sleep, even if you did go right to bed, the quality of that sleep is going to be suboptimal. And it can also trigger other symptoms like, acid reflux. We hear about people getting the GERD, getting heartburn. And so that's something that would be undesirable. So 3 hours is generally a pretty safe cutoff for most individuals.
Okay, so far we've went over, we want to be mindful not to eat too close to sleep, be mindful of the lighting and bring that down. We don't want activity right before bed and stimulating the body in that way. Let's take it to the bedroom and talk about what somebody wants to do there to enhance their sleep, things that they can do beforehand and while they're sleeping, actual changes to make in the room.
So there's one more Zygarber that's really key here, and that is temperature. In order to promote good sleep, in order for the brain to actually switch into unconsciousness, we have to actually reduce the body temperature by about 1, even up to 2 degrees Fahrenheit. Okay. And so the bedroom should be cold. Okay, not cold to the point you're shivering, but like the American Academy of Sleep Medicine generally recommends 60 to 68 degrees Fahrenheit. So cool. Now, there's some tricks or hacks, as I would say, that can help also facilitate that cooling process. Many of us like to take a shower before bed, right? Great. Feel refreshed, clean, go to bed. But a hot shower right before bed is going to warm you up. That's going to be counterproductive for your sleep. But here's the neat thing. Timing is everything here. If an individual decided to take a hot shower or a hot bath 90 minutes before their intended bedtime, what would happen is they take the shower, the core body temperature is going to go up, and then by 90 minutes later, the core body temperature is actually going to go down more so than if they hadn't even taken that hot shower at all. So this is a way to cool the body down, as well as environmental cooling by lowering your thermostat and then going to bed. You can increase the amount of deep sleep you're actually able to achieve.
Somebody wanting to time their sauna, would that fit the same 90 minutes before bed being ideal?
It would. It would. And then even if you threw some red light or you have an infrared sauna, that's the ultimate hack right there.
What do you think about these cooling mats where you can put them on top of your mattress under your sheet and you get a little machine beside the bed where you can actually directly control the temperature? And I think you can actually do it separate for 2 different people if they're on the same bed. Have you tried those, and what do you think of them?
So I haven't personally tried it, but many of my patients, they absolutely love it. I've had some that reported they don't like the sensation of moving air on them, but some have air, some are just the cooling mat itself too. So it's going to vary individual to individual, but the science behind it, by keeping the body cool, I mean that's sound. Even there's these mattresses itself is made with certain technology to keep cool. Same thing with the pillows too. So generally, it's quite well liked and can promote better sleep.
All right, talk more to mattress and pillow from a toxicity perspective, and then just as firmness, other variables in those realms.
Great question. Because it's difficult now. We live in a world where we're exposed to toxins everywhere, from the clothing that we wear to what's blowing through our air conditioners to now our bed sheets, right? So ideally, natural fibers is the way to go. Pure, if you can get like 100% silk, that's one of the best sheets right there. Pillows, pillows is pillows tends to be a very a difficult topic because there's so much variability from one person to another, and it's going to depend on sleeping positions, and so I I'm a big fan of these pillows where now you can get pillows where they'll measure the distance from your shoulder to your neck, and then if I'm a side sleeper, it can then find the right size pillow, one that's not going to overcorrect my neck or undercorrect my neck. We want it in a nice neutral position. Um, and so there are pillows where they can be, you can find the right match for you. But the other thing is, hey, we tend to move frequently in the middle of the night. I might switch from my side to my back. So what do I do then? So personally, I have a collection of pillows and they're all right available. And sometimes, let's say in the middle of the night, if I do wake up and I decided to change position, I'll change my pillow to match. Um, and so ask yourself, if are you when you wake up in the morning, do you feel kinks in your neck? Do you feel tight? If so, that might be a sign that your pillow might be suboptimal. Then the other question you mentioned that you asked was the mattress. So a lot of variations there. Firm tends to be better overall. If I took 100 people and found what is probably best for them, but it's case by case too, and it is largely dependent on what position. Side sleepers generally prefer a more softer. I usually like medium to firm, and then back sleeping firmer tends to be better. Generally, a full soft mattress, though, I find that most individuals don't prefer that. I personally don't prefer that, and I don't see too much benefit in those.
Somebody right now wanting to make a purchase, new pillow, new mattress, how would you help guide them?
Definitely try the mattress out. The Don't buy a mattress online because how do you know you're gonna like it? And now, especially, some of those mattresses where you get and it's all like compressed and then you pull the tab and it just blows open. How do you return that mattress? And so, and if you do buy a mattress, I want you to make sure that there is actually a return policy. Um, so that's number one. Sleep on it for a few nights. If for whatever reason you have any hesitation, I would return it. You need to feel 100% confident in this mattress, and this same logic would go to the pillow as well.
You mentioned moving throughout the night, and I feel like that's something most people are going to do. But within our control, at least starting out, is there an ideal body position to sleep better?
Excellent question. And here's the deal. If we look at the health of the spine, then sleeping supine is generally considered the best position. Back is nice and straight, shoulders are not hunched, they're neutral position. Great. So sleeping on the back. However, sleeping on the back, it could also be the worst position for someone who's got significant sleep apnea. How do you know if you got sleep apnea? Do you snore? A lot of times we'll hear, he only snores when he's sleeping on his back. That's a pretty good sign then that maybe sleeping on the back is not the best position for that individual. Unless he's actively treating the sleep apnea or something like that by using a mouthpiece or a CPAP machine, of course. But generally, if not actively treating the sleep apnea, sleeping on the back is probably not the best position. So then we go to sleeping on the side. That might be great. It'll treat the snoring, but are we now triggering any shoulder discomfort? Is the back in a neutral position? Is the person experiencing acid reflux? There's more to it. So it may vary person to person. So see how you feel. Do you feel that you sleep better in any one position? If so, listen to the body and even you. Here's another thing I love is doing a sleep study. A sleep study is so helpful beyond just, do I have sleep apnea? Because, if you do a sleep study, I think it's beneficial to try out different positions during that sleep study too. Because now we can see, okay, number one, what was the quality of the sleep when you were on your side? How much deep sleep, how much REM sleep did you achieve? How many times did the brain actually wake up while you're asleep? See, this is a thing called cortical arousals, that the brain can wake up even though the individual doesn't wake up and come to consciousness. And I've seen in my patients, their brain can wake up 20 plus times every hour. I've seen it even above 40 times an hour. And the patient felt like I slept through the whole night, right? So doing a sleep study that actually records the position of the sleep in addition to the quality of the sleep by determining what stages of sleep that person was able to get provides an enormous amount of clinical data that we can really help optimize someone's conditions.
So I would assume if somebody's snoring, if a partner's noticing that their partner's not breathing during the night, if their breathing stops, they're going to need a sleep study. But would you suggest one for everyone?
I would say if someone is snoring and they don't feel like they're getting the best sleep, absolutely, they should get a sleep study. In general, if they feel like they're not getting restorative sleep, what I mean by that is when they wake up, do they still feel groggy? How long does it take for them to feel, okay, I'm back. I'm in the game now. Do they wake up with headaches or dry mouth? That's often a sign. And then are they waking up in the middle of the night? Why are they waking up in the middle of the night? These are questions that we need to answer. Now, some individuals may wake up briefly. I woke up 30 seconds, rolled over, went back to bed. That might be okay. But beyond that, definitely warrants a further look. Because again, when we do that sleep study, we can look what actually happened in the 30 seconds that led up to that awakening. How was the person breathing? What was their oxygen levels? What activity was happening in the brain? Were their legs moving? How was their heart beating? Did they have an arrhythmia? Was their heart, was it beating rapidly or irregularly? These can point to clues to what's driving the sleep disturbance and help focus how we're going to get this person to sleep better.
When I hear the term sleep study, I'm picturing somebody in a lab and all kinds of wires attached to them, electrodes. What does a modern sleep study look like?
So yeah, what you just described was the traditional polysomnogram or in-lab sleep study. There's definitely lots of wires involved because remember, it's got EEG. We're actually looking at the brain waves, EKG, which monitors the heart rhythm, EMG, which measures muscle activity, and of course, we have to measure the breathing through a cannula. So there's a lot going on. So nowadays, though, we tend to do a lot of home sleep studies. Patients generally like this too because you can imagine sleeping in a lab, a foreign place, just like the first night in a hotel. We call it the first night effect. The patient may not even get the best sleep anyways, right? So when a patient's in their own bed, going to sleep on their own time, that in itself sets the test up to be more valid. Now, there's different types of home sleep studies, different tiers. Some are simple and it can be a ring on the finger. Some are more elaborate. The one I like to do that I do in my office, this is what we call a type 2 home sleep study, or a home polysomnogram is another way to think about it. Basically, it's a home sleep study that records all of those metrics that are included in the in-lab sleep study. So it's a home study with the EEG, with the EKG, and the EMG. And this is fantastic now because we get all the data in a real-world scenario.
So you mentioned Ring there quickly. Gets me thinking about the Oura Ring. I think Whoop tests sleep at night, the Apple Watch. What do you think about these end-user at-home devices?
I think they're a great way to track sleep overall. They do not replace a sleep study, though. And one of the big differences here, why the sleep study ring, why that will provide a more accurate data is the sampling rate. You see, fundamentally, one of the big concerns with someone on sleep apnea, for example, is that so sleep apnea, right, is a condition where the airway gets obstructed. It gets small. Okay. Maybe they're on their back, their tongue falls back. So that opening of the airway, again, small. And if that airway is small, getting oxygen to the lungs is going to be more difficult. And therefore, periodically, the oxygen will dip and then they'll take a gasp, and oxygen will come back up, and then it'll dip down and it'll come back up. But that dip in oxygen, it may even just last 15 seconds. 10, 15 seconds, it drops, bumps back up. But these devices, such as the Oura Ring and the Apple Watch, they generally have a sampling rate of 30 seconds. So every 30 seconds, say, this is what your average oxygen was. This was the average oxygen. So if the oxygen dropped low briefly and then bounced back up, it may just show, okay, you were at 99%, maybe you went to 94%. All right. Okay. So it'll be subtle. Whereas the sampling rate of the home sleep studies are going to be much quicker, every 3 seconds or quicker. So even if it drops quickly and then bounces back up, we'll be able to detect it and detect how low did it actually get? How concerned do we actually have to be? So that's one of the big differences. The other thing is this. These devices, they do claim it'll tell you what your sleep quality was, how much deep sleep, how much REM sleep, how much light sleep. But mind you, there's nothing connected to the brain. Therefore, the device doesn't actually directly record sleep. Instead, it uses physiologic measures to make an assumption about sleep. So like right now, you and I were awake. So my respiratory rate and the regularity of how I breathe in and out and how fast I'm breathing in and out is going to be irregular. It's going up, down, right? Likewise, my heart rate is going to get faster, slower, faster, slower. But once I fall asleep, now my heart rate becomes more regular, like a metronome. My breathing tends to slow down a little bit, and it also becomes more regular. So that device on my finger, it's looking at heart rate, and it's also looking at the pulse, the regularity of it. And so when it becomes more regular, it makes the assumption, oh, he must be asleep. Plus it measures movement. So he's not moving much. Therefore, he must be asleep. Right. And then it says, well, he's really not moving a lot and his heart rate is very regular. So he must now be in a deep sleep. Right. But these are just assumptions, physiologic assumptions that the device is making. Without actually looking at the brain waves, we can't say with 100% confidence that I'm actually in a deep sleep or stage 3 sleep, as we would refer to it.
And I could see how they could create a lot of stress for somebody, especially if they're not right with these assumptions, where they can look at their app in the morning and see their sleep quality was poor and how psychologically that could impact the person throughout the day, worrying about that when maybe the accuracy wasn't even great to start.
It can have. Sometimes it can make individuals hypervigilant. I think it can. I've seen that. So sometimes if a patient is really struggling with insomnia, I tell them just don't get too caught up in what that wearable is saying. Sometimes they even say until we get you sleeping a little bit better, I might even recommend that you just don't use the ring for now. Okay. And then once we get you sleeping better, we can reintroduce the ring.
You use the term insomnia there. I think most people have heard that. But define what that means. To me, it just means a general disruption of sleep. But what is the specific definition behind that?
So, definition of insomnia would be difficulty falling asleep or difficulty staying asleep. And it's been going on for 3 months. That would be chronic insomnia. It could be acute insomnia, which means symptoms for at least 1 month. But fundamentally, it's difficulty staying asleep or falling asleep, and has to also be associated with some sort of um, negative outcome, right? As a result of the insomnia, I'm experiencing brain fog during the day, or some sort of disruption. But if you're waking up multiple times and you feel awesome during the daytime, I wouldn't necessarily call that insomnia.
Okay, so by the sounds of it, it's a really general term that a lot of different causes could be underlying that.
It's true. A lot of things can cause insomnia. Medications, prescription medications, um, stress, psychological factors, um, hormone changes, certain medical conditions, conditions associated with inflammation can often be associated with insomnia. Of course, pain is a big one too. Other sleep disorders, such as sleep apnea, can even be associated with insomnia. And so, on that topic, because insomnia is common, okay? About 20% of individuals at some point in their life will experience insomnia, okay? Um, and there is also a difference between men and women in these sleep disorders. So, take, for example, the sleep apnea that we were talking about. Men tend to present with that classic symptom of, oh, he's snoring really loudly. I can hear him gasping for air. And then he is sleepy during the daytime, um, taking these naps, unplanned naps. Women have a higher tendency to experience insomnia as a result of their sleep apnea. So they may not present with that classic, oh, I'm sleepy, and my husband says I'm a really loud snorer, too. So up to about 50% of women with sleep apnea will present with insomnia.
Let's really take some time on the sleep apnea piece. How common is it? And it sounds like getting a sleep study is the best way to detect it. But there are different types. So let's really break this down.
Sure. So, obstructive sleep apnea, which is the most common type of sleep apnea, this one, it said that about 20 to 25% of individuals worldwide have it. Very high prevalence. And this is across the world, not just in Western countries. And a it's not a disease that only affects overweight individuals. We're seeing more and more non-obese individuals of all ages, children up into the elderly as well, affected by it. And now there's also difference between men and women here too in terms of the prevalence. So men, they have about that 25% prevalence regardless of the age that we're looking at. Women actually tend to have a lower prevalence early on, and then we find that when they through menopause, their menopausal state, the rates of obstructive sleep apnea actually go high, and then it meets up back to about that 25% as equivalent between men and women. So that's the obstructive sleep apnea, and that's one where the airway tends to get small, obstruction, which is usually in the back of the mouth, kind of the back of the throat here. And that's the one that we tend to recommend things like CPAP for, where individuals are using that machine, which is blowing air, and by using positive air pressure to keep the airway nice and open so the individual can get the oxygen from their room down into their lungs. Now, there's another type of sleep apnea called central sleep apnea. Central sleep apnea has nothing to do with airway being too small. Central sleep apnea is basically that individual is holding their breath while they're sleeping. So they're not aware that they're holding their breath. They're sleeping, but they just start holding their breath. Who might be at risk for something like central sleep apnea? Individuals who have had an insult to the brain, such as a stroke, um, another injury to the brain, like traumatic brain injury, something like that. Even individuals with heart conditions are at higher risk for central sleep apnea as well. So has the individual, do they have something like heart failure? Do they have heart arrhythmias where their heart's not beating normally? Ejection fraction. This refers to how efficient is your heart at actually pumping blood out, right? So normally ejection fraction should be 65%. So each time the heart squeezes and pumps blood, 65% of that blood should then be vacated. Ejection fractions less than 65%, higher risk for something like central sleep apnea. Or medications is another one. Uh, Opiate medications, right? Things like oxycodone, morphine, heroin. These kind of drugs, they can also suppress your drive to breathe. This could even go even further. Medications like benzodiazepines, like Xanax, Klonopin can also increase risks of central sleep apnea as well by reducing that respiratory drive. So, a lot of different things. High altitude, this is one that many individuals don't realize. So, ask yourself this: when you're at high altitude, when you went on a ski trip, Colorado, did you sleep worse? If so, why? Did you stop breathing when you were asleep? Is there any central sleep apnea going on?
Okay, you talked about the difference there between men and women. What about kids? Say teens and even younger. How often are you seeing sleep apnea in them?
It happens. Big risk factors, big tonsils. Weight, of course, plays a big role. Like, check this out. When someone gains weight, we know, okay, they might gain weight in their arms, their thighs. But did you know they actually gain weight in their tongue as well? So if I got a big, fat tongue, and especially if I'm now sleeping on my back, that tongue more likely to fall back and obstruct the airway. Another thing I'm seeing is there's a growing population of mouth breathers. Okay. And kids are especially susceptible to this, right? Because already they have small mouths. Okay. They're growing still. Okay. Now, if the mouth is open, if I open my mouth, that space in the back here, it's actually getting smaller. So simply sleeping with my mouth open, more likely that my airways is going to obstruct, more likely that I'm going to be snoring, and more likely I'm going to have poor sleep and wake up with the dry mouth. Very, very prevalent. And now this can set up as a vicious cycle because that individual is now breathing through their mouth instead of their nose. And therefore, that air is no longer filtered, right? The nose filters the air, it warms the air, it adds humidity. The mucus has antibacterial properties. But no, if I breathe through my mouth, it's raw air going straight to my lungs. Already, I'm at a higher risk of developing asthma, having seasonal allergies, and I'm also more likely to pick up viruses in the air from those around me. Now, if I have allergies, I'm even more likely to breathe through my mouth. And it just keeps going and it just keeps going. And then we're also seeing that chronic mouth breathing is actually going to result now in a smaller mouth, a smaller jawline. Notice how today it seems like every kid needs to get braces. Every kid needs to get their wisdom teeth removed. Okay? Why is that? Other day I was at a natural history museum and I'm looking at these skulls. Man, these guys back in the day, perfect teeth, right? There was no orthodontist, right? Perfect. So we as a human species, our jaws have gotten smaller. And therefore, we are now gone to the point where there's not enough room for our teeth. So we have to take the teeth out. Our teeth are getting crowded and therefore crooked. Now we have to get braces and our airways are getting obstructed. And therefore, we're ending up on things like CPAP. So that's an epidemic, if you ask me. So, mouth breathing, huge. I see this too much. Okay. And on this topic, too, I want to mention one thing. We as adults, if we don't get good sleep, fine. We kind of know what that might look like. Maybe some brain fog. I'm tired. I want to take a nap. Um, I'm a lethargic. Okay, fine. But a child who doesn't get good sleep, you know what symptoms they present with? Inattention, hyperactivity, can't sit down, difficulty focusing. Those are the same symptoms as ADHD, right? So it is now about 50% of patients with ADHD, we find they actually have an underlying sleep disorder. And so now, before a diagnosis of ADHD should be made, we should ask, how does this patient, how are they sleeping? Do they sleep with their mouth open? Could they have something like obstructive sleep apnea, which does occur? Remember, the prevalence, especially in boys, is going to be roughly about the same, that 25%. So it's very common, especially if that child is overweight and is known to be a mouth breather. Extremely high. There's a genetic component too. Do parents have sleep apnea? If so, that kid is statistically more likely to develop it as well. So very, very common, actually. Um, and so I would caution, I mean, I would do it with my own kids, and I would even for your viewers, especially those who have kids, is get a sleep study, especially before you accept the diagnosis of ADHD, and especially before attempting to take a stimulant to improve the behavior in school or something like that, because maybe just improving the sleep, that alone, a natural way to improve the behavior and outcome. Better GPAs, better performance in sports, better relationship with their peers.
So you mentioned this change historically to now with the size of kids' mouths being smaller now. What do you feel are the biggest inputs we're losing out on in the modern world that's causing that?
Now that's the question I like, because we're getting to the root cause. So what can a parent do to improve this? So number one, we actually have to use the jaws. Okay, so when a child is required to chew and bite and gnaw, and I'm using these muscles right here, is going to lead to better jaw development. And the earlier we do this, the better. That's one of the benefits of breastfeeding. When a child is breastfeeding, they have to use a lot more of their facial muscles in order to get the milk than with the bottle. So that alone requires that child to open up their mouth more and use these muscles. So breastfeeding helps. And then when the introduction of solid foods, the earlier the better. Okay, usually 4 months would be the earliest. And then now we live in a world where everything is pureed for the child, pureed, right? So initially for safety, puree, but then once that kid has teeth now and they have the ability to chew, let them actually use their teeth. Okay. And so that's one. Avoiding pacifiers is another benefit. Because see, what a pacifier is going to do is this. When it's in their mouth, what position? If I literally if I were to, what does it look like if I had a pacifier in my mouth? I'm like this, right?
Elongating the face.
Elongated face, right? So now that's going to lead to a narrow palate and a long palate. So if I looked inside that individual's mouth, the arch, meaning the roof of the mouth, is going to be higher, more domed, and more narrow. So they're like this. That's setting that individual up for a small airway and more mouth breathing. And also look where the jaws are. Jaws are here instead of here. So use the jaws, make them work for it. Breastfeeding, limit pacifiers, and there's even they make these devices too, um, where you put it in the kid's teeth, and it's like a chew toy basically for children, and I like that because again, it's going to force them to use those muscles. That's a big difference. That's the big.
Whether it be a child or an adult, we find out their mouth breathing at night. How do you feel about mouth taping?
So mouth taping, I'm a fan actually. So they say that about 50% of mild sleep apnea cases can be improved with mouth taping. Because here with mouth taping, the main idea is really what is it doing? It's just forcing you to breathe through your nose. Okay. And so by breathing through your nose, I'm going to accomplish a few things. For one, I'm bypassing the whole mouth region where the tongue is getting in the way. It's going further back. My jaw right here is going to be more up and not sag. The more my jaw sags, the smaller that airway is back, right? And now I reap all the benefits of nasal breathing. I'm filtering the air, I'm warming the air, I'm adding humidity to the air, and my mucus is also reducing my chances of getting infection. So I get filtered air. It's literally a natural air filter for my lungs. So that's one of the great benefits too. So I tried it myself. See, I mean, I was waking up. This was a couple years back. I noticed, man, I'm waking up with the dry mouth, and this went on for some time, like consistently for over a month. And so I got some mouth tape and put it on. Consistent use. I did it for 2 months straight, and you retrain yourself to keep your mouth closed. Just like how I train myself to keep a good posture and straighten my back. You can retrain yourself to breathe through your nose. And I also hear this. A lot of my patients will say, I struggle to breathe through my nose. Okay, fair. But did you know the more you actually breathe through your nose, the more it'll open up? It will actually open up. So day one might, okay, maybe it was difficult to keep the tape on for the whole duration of the night. Keep at it. Next night, put the tape back on, see how long you can last, see how long you can last. It tends to get easier.
You have a great beard. I'm curious, somebody with facial hair, how do they keep that tape on?
So I actually recommend different tapes, whether or not you have facial hair or not. So the tape I got, it was actually called, it said beard friendly on it. And it really stuck to my beard. So that worked great. Of course, and so I tried the other mouth tapes. They just fell right off, or I woke up in the middle of the night and it just wasn't on anymore. And experiment a little with mouth tape. If you're gonna get it, just buy 1 month supply first. You might find if you don't like one brand, you might like another brand. Generally, I like ones that are a little stretchy. So then that way, if you gotta itch yourself like this, you don't feel so restricted. So that tends to work nicely.
You mentioned there the fact that mild sleep apnea, mouth taping could help. You mentioned earlier the CPAP machine. Talk more to that technology. And then for people that's not working for, they want to try different ways to go about remedying the sleep apnea, sorry. What are other technologies in that realm?
Yeah. So remember, if someone's got obstructive sleep apnea, their airway is getting narrowed and we need to pop it back open. So we often use air. Think of it as a pneumatic splint, pushing air, opening that airway up, right? So that's the CPAP machine. They put the mask on and the air is blowing either through their nose or their mouth, or kind of like both, depending on the type of mask that they have. Remember me though, I'm a big fan of the nasal breathing. So I generally recommend trying a nasal mask first because now it's forcing yourself to utilize the nose. Now, Some individuals, there's some component of personal preference. So if you've tried a nasal mask, don't like it, fine, try a full face mask, see if you can tolerate that better. Okay. But there are other ways to treat sleep apnea beyond CPAP. So, for example, they make these things called mandibular advancement devices. It looks a lot like a retainer, and what it's focused on is pulling the jaw forward. So, just a little bit like this. Again, the obstruction's usually in the back of the mouth. So these devices pull the jaw forward, opens that space up. And for mild to moderate sleep apnea, it tends to work pretty well. So CPAP, of course, is statistically speaking, if I had 100 patients and I was like, okay, which one's going to be the most effective by actually, if we look at the, which one is going to keep their oxygen high and get them to consistently breathe throughout the night, it tends to be CPAP. But at the end of the day, you have to be able to actually sleep with this thing on. So if it's not CPAP, it could be the mouthpiece. It could be just a little mouth tape. It could even be something called orofacial myofunctional therapy. Let me explain what this is. OMT, we abbreviate it. This is basically tongue exercises. Okay. Did you know, Jesse, that there's a correct place to keep your tongue?
I've heard. This is more when you're relaxing throughout the day. I believe it's up on the roof of the mouth behind the top teeth.
That's correct. But it needs to stay there even when you're asleep. And this is why we have to train ourselves. So then it becomes second nature. Okay. So there are exercises that we can do to then help maintain that position. And sometimes that in itself, if you got a mild case of sleep apnea, that can often take care of that. And it's important to teach this early on before bad habits set in, just like how we tell our child, sit up. So I got kids myself. I notice if I see them breathing through their mouth, we immediately going to put a stop to that. Sometimes I'll even see my daughter she'll be sleeping and I notice that mouth will open up. So I'll just gently close it and she's fine. She'll breathe through her nose. But setting good habits early on makes a big difference. Focusing on the tongue. There's even devices that they have made now. It's a TENS machine for the tongue. Basically, it provides electrical stimulation to the tongue and cause certain muscles to contract and strengthen over time, which is a more passive way of doing those tongue exercises. But that has shown clinically to treat mild sleep apnea as well.
I know there's these devices too that stick on the tongue and hold it forward during the night. Any thoughts on those?
Again, all accomplishing a similar concept, moving things forward to open up the space in the back of the mouth. So yeah, it could work. There's even another device that provides electrical stimulation synchronized with your breathing and moves the tongue forward. Hypoglossal nerve stimulator is what those are.
Somebody that's had a problem with sleep apnea, say for 20, 30 years, they're still pushing through the days. They're tired, but they're doing it. When they get this corrected using one of the devices you're talking about here, what's the biggest difference they notice and how quickly?
It can be as quickly as one night. I can't even count the number of times patients, I start them on CPAP. Night one, they say, wow, that was the best sleep of my life. Many times they'll say, I didn't even know what good sleep was because I've been experiencing this pretty much my whole life. So it could be as quick as that. For some individuals, it takes time to actually get used to the sensation of wearing a mask or a mouthpiece. And so they might take them a little bit longer. But generally, once that airway stays open, they get deeper sleep and they'll notice those effects pretty quickly. And sometimes the symptoms that they had been experiencing can be a little subtle. Like I woke up with just a dull headache. I woke up with this dry mouth. Or get this one, waking up to urinate in the middle of the night. The prostate gets blamed too often. It's not always an enlarged prostate. Because I see, I mean, man's only 35 years old. It's not the prostate. You treat the sleep disorder, you treat the sleep apnea, the nighttime urination gets better. It can get better.
Okay, I want to talk more to this having to pee during the night thing. But first, I want to step back and talk about getting up in the middle of the night in general. Somebody that finds themselves on a regular basis waking up, say, between 2 and 4 in the morning, how common is that? And what's at the root of that?
It's quite common, actually. You see, throughout the night, we tend to go through all the sleep stages several times, 4 to 6 times. And waking up at the end of one of those sleep stages, cycles, is actually fairly common. And it might be 30 seconds that they're up, they fall back asleep. They may not even have realized they actually woke up. Okay, so now sometimes those awakenings could be a little bit longer. They actually come to consciousness, and it could be triggered by many, many different things. Of course, sleep apnea, stress, acid reflux, the GERD, heartburn, the need to pee, of course, a lot of different factors. Caffeine use is a big one here. Caffeine too late in the day. Alcohol is a huge one too, especially if alcohol is consumed within 3 hours of their bedtime. Alcohol, one thing on alcohol, probably the most commonly used sleep aid worldwide, but it's a terrible sleep aid. It might help you fall asleep initially, but you'll struggle to stay asleep throughout the night, and the depth of the sleep is compromised too. So we call it sleep architecture, how the quality of the sleep, and it's definitely impaired in individuals with alcohol consumption.
For somebody that you named a number of causes there that could be at the root of waking up during the middle of the night, for somebody that can't really get to the root of that, but it's happening on a regular basis, any strategies for falling back asleep? If they find themselves lying there for an hour, 2 hours go by, they start stressing, they're missing out on their sleep, what can they do in the middle of the night to get back?
So, after 20 minutes, you haven't fallen asleep, and you don't think you're about to fall asleep in the next minute or so, leave the bed. Just leave the bed, go to a different room, don't turn the lights on too bright, but do something. Do some activity that's not too exciting, too stimulating. Don't watch TV. I think like something like read a book. Maybe do, if you like to knit, maybe do some whatever activity that's to the individual and their hobbies. Okay, do some activity, and then generally you'll feel that wave of sleepiness come over you. Then go back to the bed, ride that wave, and try again. But if you're getting the feeling of frustration, man, or the dread, what's tomorrow gonna be like if I don't fall back asleep? Once those feelings come, it makes it that much harder to fall asleep. So don't fight it. Just leave the bed. Because what can happen is night after night, if individuals are spending this prolonged time awake in bed, our brain gets reconditioned. We want our brain to associate our bed with sleep. But over time, if we start to associate the bed with all those times I'm laying awake, all that dread, all that frustration, all that boredom, or whatever, that is going to be counterintuitive now, because now your brain will just see the bed and suddenly all that comes right to the forefront, and then your opportunity for sleep is going to be restricted. So leave the bed. 20-minute rule, that tends to work pretty well. That's a fundamental part of this program called cognitive behavioral therapy for insomnia, often abbreviated CBTI. But this has been shown clinically to be one of the most effective ways to treat insomnia, even better than sleeping pills, especially in the long run. So that's a big one. And then be mindful of what you actually do. Don't get your heart rate up. Don't get too excited. TV, be mindful of that blue light. sometimes even just changing the color of your bulb can make a difference. So let's say someone wakes up because they have to use the bathroom. And then when they're in the bathroom, they're turning on that bright white light. That could be a problem. So having a red hue bulb, that in itself would be a lot less stimulating to the brain. And then avoid food. Remember, we talked about food is a potent zeitgeber. So if you're eating in the middle of the night, you're telling the brain, I'm supposed to be awake right now. And the brain is going to behave just like that. So avoid the food, of course.
Whether it be in the middle of the night having trouble falling back asleep or having trouble falling asleep just at bedtime, how do you feel about meditation as a tool?
Meditation is fantastic. Okay, if we did an EEG, looking at the actual brain waves of that individual, we're seeing that the brain waves, which are really fast when they're awake, we call them beta waves, very fast, and then they start to slow down, slow down. Slow waves are good. Slow waves are good. So there's that. Clears the mind as well. If we're thinking about 1,000 things at the same time, it makes it very hard. And it can actually even relax the body too, because we're being mindful of our breathing, prolonged exhales. You may have heard of the vagus nerve, largest nerve in the human body, part of the parasympathetic nervous system, the part of our autonomic system that promotes relaxation. So just that, we are relaxing the mind and body simultaneously. If our body is tense, our mind is more likely to be tense. So that's why yoga and meditation go so well together, because the yoga relaxes the body, which therein relaxes the mind, which helps the brain achieve a deeper meditation too. So that before bed is a fantastic idea.
I want to come back to having to pee during the night. So you mentioned the fact that you feel prostates are being blamed too much. What are the different causes you see with people having to pee during the night? Obviously, if we're drinking too much before bed, but if somebody's saying, okay, this isn't the prostate, I've had that ruled out, there's no challenge there, I'm not drinking before bed, but I keep waking up to pee throughout the night and it's just disrupting my sleep. Any other causes there?
So don't drink too much water. 2 hours before bedtime should be the cutoff. Okay. And it's not the prostate in this case. So then we have to look at blood flow. Okay. And this is where sleep apnea once again comes into picture here, because I'm going to explain the physiology here, because this is fascinating. So imagine in sleep apnea, the person is effectively being choked, right? So it's choked up here, but they're still trying to breathe. If you look at their belly's still moving up and down, just like someone who's being choked. So when the glottis here is closed, but the diaphragm moves down, I'm trying to inhale. That effectively creates a vacuum. Okay, so think of a negative pressure within my chest. So if I look at blood flow towards the heart, the blood flow actually goes up. There's more blood coming into the heart. So by volume, there's more blood that ends up in the heart. So the heart, like a balloon, is getting overfilled. The balloon is getting stretched. Now here's where it gets really interesting. When the heart is getting stretched, it releases a hormone. That hormone is called ANP, atrial natriuretic peptide. And that hormone then goes to the kidneys and it sends a signal. And the signal it gives the kidneys is, hey, the heart said that there's too much pressure. There's too much volume in the heart. There's too much pressure. So what does the kidney do in response? Too much pressure, too much volume. Okay, I need to release some urine and bring that volume down. That is the mechanism by which a sleep apnea patient has to end up going to use the bathroom multiple times in the middle of the night.
That's really cool. I'd heard of that connection, but I've never heard of the physiology. So really cool.
Yeah, it's one of my favorites.
So we've talked about insomnia, sleep apnea. What other major conditions or disorders do you see commonly affecting people's sleep?
Inflammatory conditions is a big one. So, how many autoimmune diseases are there now? How many individuals are living with chronic inflammation? In a chronically inflamed state, that individual's brain is basically on high guard. Think about it this way: sleep is a very vulnerable state, right? If I'm sleeping, I cannot protect myself from predators. I can be eaten by something. Um, so, if my body is perceiving a threat, and chronic inflammation is it's a chronic threat, it's a real threat, that person's brain is unlikely to let its guard down. And therefore, the slightest thing in that person's brain will wake up. So if we did an EEG and we're looking at this person's brain waves, we find that the brain will wake up multiple times in the night. It could be the slightest gasp of air, the slightest sound in the room, the slightest turn of my body, boom, the brain woke up. So that is rampant. And that will keep going on until the inflammation is taken care of. The threat has to be removed. So we have to target the inflammation. So then we have to identify, well, where is the inflammation actually coming from? What is perpetuating it? Why is it not going away? Why is it, why is it chronic? And then focus, okay, now what can we do to actually get that inflammation down? So we do a lot of testing, lab work, extensive lab work to identify those culprits. And that can make a huge difference.
When it comes to inflammation and you do this testing, what are the most common culprits?
Big ones, gut health. So permeable intestinal membranes, or you may have heard of something called leaky gut syndrome. So here now, anytime I eat something, some parts of that food are supposed to be absorbed and enter my bloodstream. Okay. But if I have a leaky gut, meaning that the walls of my intestines are not nice and strong and non permeable, things are going to enter and go through the intestinal lining that wasn't supposed to ever go through. And then it's going to then trigger inflammation within the body. And that inflammation is going to keep happening because I keep eating and my gut never healed. So that's a big one. That's a big one. Stress is another big one that will again if the brain keeps perceiving a threat, and if I'm stuck in a fight or flight state, that too is going to perpetuate the problem.
All right, so we've gone over inflammation. Any other big ones you commonly see causes affecting sleep in a negative way?
Hormones is very common. Let's say when an individual is going through menopause, sleep disturbances are common. Okay, so we know that there's a strong connection there. But here's where it gets tricky. Poor sleep can actually result in lower hormones. So testosterone, for example, men who get insufficient sleep, if they get only 5 hours of sleep, and if I measured 2 weeks later, what's their testosterone levels? It'll be about 20% down just after 2 weeks. And in testosterone replacement therapy today is quite rampant. And then the individuals, these men will take the testosterone and they genuinely feel better. Okay. But what led to the testosterone being low in the first place? It's often poor sleep. So here's the cool thing though. Specifically testosterone, improving the total sleep time back to 7 hours or better, 80% of those cases, testosterone levels will come back up.
What about for the women going through menopause, having that natural change? Any strategies to help with sleep?
Great question. So, to some extent, right, those hormones are going to go down, and that's part of the natural process. Okay, fair. Um, and so that's why we have to make sure that all the conditions for good sleep are still met. So, of course, all that sleep hygiene, doing all optimizing your light, the timing of your sleep, all that key. And there's sometimes I use some supplements too. There's some good supplements like glycine. Glycine has been shown repeatedly to increase the depth of the sleep, reduce nighttime awakenings. It's not habit forming and is usually very well tolerated. So that before bedtime can also make a big difference. But really, sometimes it's as simple as going to bed at the right time. Because when it comes to regulation of these sex hormones, specifically, it's not just sleep that matters. It is stage 3 sleep, the deep sleep. And your opportunity for you only get that deep sleep in the first half of the night. Now, here's the interesting thing. If my circadian rhythm, my clock is set to fall asleep at 10 o'clock and wake up at 6 a.m. And for whatever reason, I decide at 10 o'clock, I'm not going to bed, and I were to stay up to 1 a.m. And I still get my 8 hours of sleep, I will actually have significantly less deep sleep because it's not just getting 8 hours of sleep, but you have to get the sleep within that window that matches your circadian rhythm. In which case, in this case, the 10 to 6 person, it's 10 p.m. to 1 a.m. That is the opportunity to get the deep sleep. And if for whatever reason you didn't get to bed on time and you go to bed at 1 and still get that 8 hours of sleep, don't get the deep sleep. And that can still result in all those deregulation of those hormones, which then can perpetuate more sleep problems and create that vicious cycle. So go to bed on time. I can't stress that enough. And try to wake up at the same time too, because that will maintain a predictable internal clock.
Okay, how different is it person to person, the ideal period to sleep? So what time you go to bed and what time you get up in the morning and how much sleep we need. So what I'm getting at is chronotypes. And then how much of that is genetic, if that's something you believe in, and how much of it is just lifestyle and what we trained our body.
So yeah, what you're referring to is the chronotype. And what that is basically some people are programmed to be early risers. Okay, they go to bed early, they wake up early. Some people are night owls. They go to bed late, they wake up late. And the key thing here is it's not that that's what they do, it's that they do it and they feel the best under those conditions. All right, so function plus sleep habits. Then there's questionnaires. You can take a test online and it'll tell you, hey, your chronotype is likely this given all the how you responded. There is a genetic component to it. Majority of us, though, do not fall in either extreme, the night owl or the early bird. We're right in the middle. So for most of us, I say generally try to stick to kind of what we would consider a quote unquote normal sleep schedule. But yeah, it's interesting if you take that questionnaire, see where you fall and then adjust. And then is your work schedule flexible? Like, do you even have the option to sleep in and go to bed later? I mean, go to work at a later time. But the problem is most of us have to be at work at like 8 or 9 a.m. And if you have a late night owl chronotype, that's a real struggle. That's a real struggle for those individuals.
So you've talked about the fact we want to have this 90 minutes to wind down at the end of the night, just so we can put this all together and work that timing. What time for the average person should they be going to sleep? And then how long do they need to sleep for?
So 7 to 9 hours is the recommendation. And this also can be a little tricky because some people, 7 hours, they feel fantastic. They sleep for 9 hours, they feel groggy, right? So there's going to be person to person. So it does require a little bit of experimentation, right? It's maybe 1 week, say 7, next week 8, next week 9, and then ask yourself which one did I actually feel the best, and then stick to that, and then see, and then go to bed and wake up at whatever time you need in order to make sure you got those hours in. Listening to the body, though, going to bed when you feel sleepy rather than what the time is on the clock, because if you're going to bed too late, again, you might be jeopardizing your ability to get the ample deep sleep. So listen to your body. Gotta listen to the body.
What about somebody on atypical hours for work? Say they're on night shift constantly, or what I would assume would be even worse, where they switch back and forth and their body's always having to reconfigure. What do you think about that? And what's the best they can do?
Yeah, my heart goes out to shift workers. That is very difficult. So try to emulate nature in the best that they can. So for example, let's say they're working through the night and then they're going to go home, but the sun is out. Okay, what can they do? On their drive home, they could be wearing sunglasses, try to limit the amount of light that they're being exposed to, having the blackout shades in their bedroom, using even at work, let's say that last hour of work, maybe switching over to a blue light blocking glasses and then the sunglasses on the drive home. That can make a big difference. And then once they go home, this one's key. Often try to avoid eating and then going straight to bed, because that food is going to disrupt the circadian rhythm and it's going to affect the quality of the sleep too. So in an ideal world, you just go home, go to bed. And then when you wake up, then eat your food there. That would be great. And then, adding some supplements too can make a difference. Glycine has a great role here too.
Okay, so you mentioned the Zeitgeipers, light in food and working with those. I would assume temperature, and there was one more you mentioned too, activity. For the night shift worker, I would assume working with those on their different clock would make sense.
Yeah. Social interaction, socialness is also a potent Zeitgeiber too. And so that's why, scrolling, for example, that can be so detrimental because it's not just the blue light, it's not just the dopamine that they're getting out of it, but it's also the social aspect of it too. So again, when you go home from work in this scenario, that's probably not the best time to scroll. If you must, do it when you wake up.
Okay, so we've mentioned glycine a couple times. We went deep into melatonin early on. Any other supplements to consider when it comes to sleep?
The rest of it, there's a lot of variation. Take, for example, does the person have any mood issues? Sometimes depression, for example, and sleep disturbances, they can go hand in hand. So do we need something to help with the mood? Something like that can increase serotonin levels at baseline, L-tryptophan. Is anxiety playing a role in this person's sleep issues? There's some natural supplements such as L-theanine that can also have some relaxing properties and promote deeper sleep as well. Is the person in fight or flight? There's other supplements that can be used under those conditions to so I'd say that in those it is some case by case variation, but glycine tends to be pretty safe for across the board.
The one I often hear is magnesium before bed. Are you a
Oh,
fan of
yeah.
that?
I do like magnesium. Yeah, there's different types of magnesium. So I'm glad you brought this up because the one that helps for sleep is one called magnesium glycinate. It's basically a magnesium molecule that has glycine attached to it. Okay. So, we've been talking about glycine, but usually magnesium glycinate, and how much glycine you're actually getting is not enough. So that's why we'll often supplement with a little extra glycine. But magnesium glycinate has been shown to improve sleep quality. It's also relaxing as well. It could also relax the body and promote deeper, better sleep. Be careful though, because there are products out there that are listed as a magnesium-based sleep supplement, and it'll use other formulations called like magnesium citrate. Magnesium citrate is commonly used to flush out the bowels when someone's constipated. Okay. That is not the best for sleep. So magnesium glycinate is the one you want to make sure you're getting.
Any thoughts on dosage?
Minimum would be 200, but usually I will go 300, even up to 600 milligrams. And the timing is also key here. Don't make the mistake of just taking the magnesium right when you're going to bed, because now it takes time for that magnesium to actually be absorbed and do it what it needs to do. And so remember, your opportunity for the good deep sleep is the first 3 hours. So you need that magnesium already well into your system at the start of that window. And so ideally take the magnesium 1 to ideally 2 hours before bedtime, and then allow it to do its thing.
For somebody relying on medication for sleep, how does that actually impact the quality of the sleep? And then are there any challenges there?
So sleep medication, so like a prescription sleeping pill, I mean, it does put you to sleep. But the architecture of the sleep, so how much of the deep sleep is that individual getting? It does not replicate natural sleep. So not all sleep is created equal. That person may not necessarily wake up feeling refreshed in the way that good natural sleep should do. And it can also be associated with adverse side effects. Sleepwalking is a common one. Sleep driving, that's the scary one that's been reported. Sleep eating is another one. But next day grogginess tends to be a very common one across the board. And then not to mention they're habit forming. They can be very habit forming. And then now we have to deal, that's a whole nother problem that we've now introduced into the equation. So always natural sleep over sleeping pills. That's why guidelines recommend things like the CBTI, the cognitive behavioral therapy for insomnia, before sleeping pills, because in the long run, it's more efficacious without all the side effects and problems that it brings about.
Okay, so we've gone over medications now. You talked about alcohol and the negative impact there on sleep. Let's bring in the other one part of this trifecta, caffeine. What do you think about caffeine in general?
Yeah.
And then how can somebody use that in a healthy way and not negatively impact sleep?
Yes, I love my coffee. So there is a healthier way to do it. Okay. We have to understand how caffeine actually works. Okay. Caffeine is not necessarily a stimulant like an Adderall would be. Okay. Caffeine works by blocking adenosine. So let's touch on this. So adenosine is a chemical in the brain, and the longer I'm awake, adenosine levels go up, 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 up. Okay, the more adenosine in my brain, the sleepier I feel. Like the drive for sleep is more. Okay, that's why if I've been awake for 24 hours, I could probably fall asleep quicker because I have such a strong drive for sleep. Right. Caffeine works by blocking the adenosine receptor. So although that adenosine level is high, it's as if my brain is basically thinking it feels like the adenosine levels are not high. Okay, so now that it drops my drive for sleep. So that's how it works. Now, caffeine has a very long half-life, okay? And it can vary significantly from person to person. So it could be 4 hours, it could be 8 hours, okay? So imagine if I'm having a dose late in the afternoon, let's say 4 p.m., I have a cup of coffee. At bedtime, there's still a significant amount of that caffeine well in my system. And it could do a few things. Number one, I may not be able to fall asleep. But here's another one. I might actually fall asleep despite having had the caffeine, but the sleep architecture is compromised. What is the threshold? How often does my brain wake up in the middle of the night? How much of the deep sleep am I getting? How consolidated is my sleep? Meaning I get to a sleep stage and I actually stay in there rather than jumping from a deep sleep, light sleep, deep sleep, light sleep, right? So caffeine, even if you are asleep, can still be affecting your sleep. So we often hear, oh, I can have an espresso and fall right to sleep. So be careful. Be careful because your sleep could probably be better if you didn't do that.
Let's tie the adenosine story to naps. What happens when we nap during the day? And then potential impact on sleep architecture at night.
Yeah. So basically, like taking a nap in the middle of the day is basically like having a cup of coffee right then, right? Because see, when you nap, the minute you fall asleep, those adenosine levels, it starts to get washed out, and the adenosine level goes down. And it goes down fast. Okay, so even just a 20-minute nap, I washed out all that adenosine from my system. So now, let's say I took a nap at 4 p.m. and then I get in bed at 10 p.m. I'm trying to go to bed. There's not enough adenosine that has built up. So my drive for sleep is too low and I'm not going to go to bed. I'll struggle. So that's how naps. So I'm not totally against naps, but if it's going to affect your bedtime and your ability to sleep at your recommended bedtime, then it's a problem. But then also you have to ask yourself, why do you feel the need to take a nap in the first place? Because that might be the first sign that you have a sleep disorder. Or are you experiencing daytime fatigue or sleepiness due to something else that we need to look at? So
What about other ways, either substances or modalities, maybe even meditation, things we can do to modulate adenosine?
So there's certain kinds of yoga. This is type of yoga. It's called yoga nidra, Nidra, yoga nidra. This is a type of yoga that you can do while actually laying down, and it doesn't require stretches, kind of contorting your body, none of that. Okay, you're just laying it down. It's almost like it's more meditative. Okay, but studies have shown that just half an hour of yoga nidra can result in a drop of daytime sleepiness, improved performance, and even some drop of adenosine just with that alone. So that that could be a hack in someone who, let's say, you don't necessarily want to take a nap, but you want to just get relaxed for an event coming up. You could do some yoga nidra as a substitute for a nap without necessarily affecting your bedtime.
So we've talked about deep sleep and how first half of the night is where we get that if we've done the right things. Let's go through a hypothetical situation. Somebody taking that 90 minutes, properly getting ready for sleep, going to bed at the right time for them, say 10 p.m. Walk me through the different stages of sleep and what happens throughout a night.
So once they fall asleep, they first in stage one. Okay, so stage one sleep. Think of this as relaxation. Someone who's in stage one sleep might actually feel like they were awake. So if you were in stage one sleep and then I woke you up and asked you, "Hey, were you sleeping?" You might say no. No, because you're still a little bit connected. You might still hear some, sounds in the room. There's still some awareness. Then that usually doesn't last too long, a couple minutes. Then you go to stage two sleep. Stage two is what I would refer to as general light sleep. Okay, here you are unconscious and heart rate, all those processes more regular. Okay. And then you progress to stage three. Stage three is where the magic happens, right? Stage one is brief. 5% of your total sleep time. Stage 2, 50%. Stage 3, about 20%. Stage 3 is arguably the most important because now you're in stage 3 sleep. If I look at the brain waves, I see these giant waves, big. That's why we call it delta sleep, because we see these big delta shape waves like this. Can't miss it if you were looking at an EEG. And now you're releasing growth hormone. 70% of the growth hormone that your brain releases is during stage 3 sleep. Now, that growth hormone is going to help you build muscle. It's going to help you repair tissue. It's also going to help in the production of other things like antibodies. Okay, so general healing. Think of that. General healing as a result of the growth hormone released in stage 3 sleep. In stage 3 sleep too, as I said, you're making antibodies, all your immune functions. There are things like Treg cells. Okay, these are cells that basically help determine what is a threat, what is not a threat in the body. Okay, so these guys are out there surveillancing, and so those are released during stage 3 sleep. So if an individual is not getting their deep sleep, there's a higher risk that their immune system is going to be dysregulated. They might mount an immune response to their own self. That's autoimmunity, right? So critical for immune functioning to know what is actually a threat and what's not, how to deal with that threat is during stage 3 sleep. And then memory consolidation is a big one too. Specifically something called declarative memory. Declarative memory is the type of memory like remembering a date or remembering someone's name. This is why they say before a big test, make sure you get a good night's sleep, because you'll actually recall that information. You have to put that information into long-term memory, but then on test day, you actually have to be able to recall it too. And so stage 3 sleep plays an important role in there. And then now we progress to REM. REM stands for rapid eye movement. REM sleep is often, I have a lot of patients, they say REM sleep is the deep sleep, right? And I push back a little, because if you look at the brain when someone is in REM sleep, it looks wide awake. Okay. The body is relaxed during REM, but the brain is wide awake. Okay. It is the stage of sleep where someone's dreaming. Okay. So you can, all those processes, visualizations, emotions, all that stuff is being processed during the dream. And memory consolidation happens here too. But the type of memory consolidation that happens in REM is very different from the memory consolidation that happens during deep sleep or stage 3 sleep. Instead of it being declarative, meaning like the facts, in REM sleep is where we code the memory of the emotion attached to a certain event. Okay. It's a very creative state, hence the dreams. And so REM sleep actually plays a very important role in our ability to emotionally regulate in a way where we are disconnected from the actual stimuli. So let's say I had a stressful day. You notice how often the stressful aspect of your day ends up in some form in your dream. And so think of it, that is your brain's way to try to break down that event so it can figure out, how am I going to deal with the emotion of it in a way that's safe, because you are separate from the actual event. We're no longer in the event. Now it's just all imagery, basically. But it plays a critical role, such that individuals who don't get enough REM sleep are at significantly higher risk for anxiety and depression. Their mood directly can be affected. So that's a key, one of the important reasons why we need to dream. Do we remember our dreams? We may forget our dreams pretty early. Like, after the first few seconds of waking up, if we don't write it down, something, we might forget it. But the more important, are we aware that we dreamt at all? If someone says, I don't dream, that's concerning. I would want to know, are they getting REM sleep? And if they're not, why not? Because it can affect the brain, it can affect their mood, it can affect their life.
As a sleep expert, when it comes to dreams, do you see them in any esoteric, deeper meaning of life? Because they're such a mystery type thing, right, for all of us. But you're somebody that's dedicated a good part of your life to sleep, and this is within that realm. So I'm just curious how you see those.
Dreaming, I think there's so many benefits to it. I say if you can be more in touch with your dreams, there's so many benefits. For example, take the story of Thomas Edison. Okay. Everyone knows Thomas Edison. Did you know that when he was in his lab and he would take a nap, he used to hold these like steel balls. Okay. And he would hold them and he would take his nap. And then once he would start to fall asleep, he would drop the ball and then that would wake him up. Okay. But in that moment, kind of that between full consciousness and unconsciousness and kind of like a dream-like state, he would come up with these creative ideas that's how he came up with many of these inventions too. So our creativity in that state, as long as we can like remember some aspect of it, can be hugely beneficial for us in our lives. And then again, sometimes it's not just the content of the dream, which can often be bizarre, but think what is the emotional component of this dream? And if you can understand that, then I think that can make a profound improvement of how we deal with stress, exposures that we've had, past traumas, which can sometimes just keep coming back and in different forms. So how do we need to process it and move on. And dreams is a method by which we can accomplish that.
For somebody realizing through testing they're not getting that REM sleep, that deep sleep, given their importance, are there ways to hack that and get more of those? If somebody's realizing consistently through testing, I'm just not getting there.
So they need to know, what are the REM suppressants? Okay, what is preventing you from getting REM sleep? Number one, alcohol. Probably number one on the list. Stop drinking. Number two, medications can play a role. Things like beta blockers, which a lot of heart patients might be on, they can suppress. Sometimes switching to a different kind of beta blocker that doesn't cross that blood-brain barrier, so it can't enter the brain, it's less likely to affect the sleep. So if you have a cardiologist and you're on a beta blocker, I'd say talk to your cardiologist about switching to one of those. Other medications, notorious, is psychiatric medications, SSRIs. So things like Zoloft, Prozac, very potent REM suppressors. Now you can imagine the concern I have here. These patients presenting with anxiety or depression are taking a medication that suppresses REM, which results in anxiety and depression. All right, it's a problem. But the medication is trying to increase serotonin, which is that feel-good neurotransmitter, so they feel better. But if you look at if you're going deep into that individual's physiology, by suppressing REM, we're kind of throwing fuel at the fire. So They are antidepressants that don't affect REM. And so switching to something like that can make a big difference. But I think that's an area of psychiatry that hopefully in the next years to decade, we definitely become more and more aware that these individuals need more REM, and so we need a medication that doesn't reduce their REM. Would be hugely beneficial. Um, and then also note this: when do you go into REM? It's the second half of the night. So, are you waking up multiple times in the second half of the night? If so, you're missing that opportunity for good REM sleep. So, take for example, sleep apnea. For most individuals, sleep apnea is worse in REM sleep. Why? The reason is when someone is in REM sleep and they're dreaming, their body becomes paralyzed. That's critical because otherwise, if I'm dreaming that I'm fighting someone and I start throwing punches in bed, that's a problem, right? So my body needs to be paralyzed. If my body's paralyzed, so is my tongue. So are these muscles here in my neck. So if those are all paralyzed while I'm in REM sleep, my airway is more floppy. And therefore, I'm more likely to have an obstructive apnea where my airway blocks my airway, it gets closed off, and I can't breathe. That's an obstructive apnea. So some individuals only have sleep apnea when they are in REM sleep, in which case they'll know the first half of the night I sleep great. And then the second half of the night, it's like I'm waking up and I feel like I'm choking or something like that, in which case they, of course, have to treat the sleep apnea. But that very common that will affect their REM. And then ultimately, 50% of those individuals will also present with depression-like symptoms. Not surprising there.
All right, last topic I want to explore with you today: the connection between insulin resistance, metabolic dysfunction, and sleep. Talk about that.
It's a huge one. So, this is an alarming study. If you take a group of individuals and you limit them to less than 6 hours of sleep, and you were to check their insulin sensitivity after just 3 days, clinically they would show pre-diabetic. They were healthy at the beginning of the study, but just 3 days of insufficient sleep and they're already pre-diabetic. Because poor sleep has been associated with insulin resistance and therefore reduced insulin sensitivity. So that's huge. And then if we look at metabolism and weight, individuals who get insufficient sleep are at significantly higher risk of obesity. In children, there's almost an 80% increased risk of obesity if they're not sleeping well, or sleeping enough. And so that's because sleep plays an important role in the regulation of your hunger hormones. So kind of the two big ones is one's called leptin. And leptin is basically, it's released by the fat cells and it tells the brain when you are full. So leptin, you're full. The other one is called ghrelin. It's released from the stomach. And this one will signal hunger. Ghrelin levels up, you feel more hungry. In individuals who get insufficient sleep, they develop something called leptin resistance. So the brain can't receive the signal of I'm full, of satiety. And the ghrelin levels goes up. And so they feel more hunger. So did you know in an individual who had poor sleep, and if you were to measure their caloric intake the next day, it's about 300 calories more on average, give or take. So they tend to eat more as a result. In addition, their cortisol levels are also higher. So cortisol levels is also going to contribute to higher blood sugars, more weight gain, more stress, right? It's a stress hormone. And they feel more hungry and less full. And the choice of food also changes. So that individual who had poor night's sleep, not only they're going to eat more, but they're also going to crave more junk food, basically. Carbohydrate rich foods. It's been shown clinically. And so just adding more fuel to the fire. Now get this study, when I learned about this, I was mind blown. If I have two groups and they're both losing weight, actively losing weight, great, awesome. But I take one group and I'm going to make them a little sleep deprived versus the other group. The weight that they are losing will change, such that the group that's getting insufficient sleep, they're going to lose weight, but a lot of that weight will come from the muscle. They're losing some lean mass. Whereas the group that's getting sufficient sleep, they're losing weight, they're actually losing fat, the thing we actually want to lose. We don't want to lose muscle. So if you're losing weight and you want to make sure you're losing the right weight, we want to make sure you're getting enough sleep. Huge.
How reversible is this?
It is reversible. Just get your sleep back on track. This is all reversible.
All right, we've shared a lot of great information today. Somebody feeling overwhelmed, but they want to take action after the chat. What are 3 things they can do right after this conversation before they go to bed tonight to improve their sleep?
Yeah, okay. Let's see, 3 things. Number 1, do something that you enjoy, that's relaxing, that's preferably without technology. Start that about 90 minutes before bedtime and get relaxed. Be excited to go to bed. Think of it as an indulgence, right? It is like you look forward to a dessert. Look forward to your sleep. Okay? That's huge. Next, create predictability in your day-to-day. Eat at the same times every day. Go to bed around the same time. Wake up at the same time every day, even if it's on the weekends. So then that way your circadian rhythm is like clockwork. Okay. And number 3, I would say, we only get 3. So the third one I would say is activity during the daytime. If you want a good night's sleep, you need a good day's activity. Okay. So you keep your body moving, go for walks, especially in the morning is excellent. If the sun's rising, even when the sun's going down, those kind of red hues emitted from the sun during those specific hours, huge, especially its effect on the sleep timing. So keep moving the body, tire the body out a little during the day, and then it's setting yourself up for a more sounder, deeper sleep at night.
Somebody that's tuned into this point, they're struggling with their sleep. They want some help. They want to work with you. How do they go about doing that?
I offer televisits. Otherwise, happy to see you in person. My office is in Orlando, Florida. Aristotle Education is the name of the clinic. And I have a sleep restoration program. So we do include that home sleep study that has the EEG, the EMG. We do the extensive testing of labs to identify inflammation sources of it and come up with the protocol to of course get to the root cause of that, and then of course ongoing follow-ups to follow your sleep as you go on this journey.
All right, Dr. Jeeten, really enjoyed the conversation. We're going to link everything up in the show notes. Thank you for this. I appreciate you.
Thanks for having me. Sleep well.
Thank you for watching. Stick around here for this other great interview. You don't want to miss it. I'll see you over there.
Shockingly, there is literature from the 1980s that shows that there are vitamin D receptors in the sleep switches that actually perform these particular duties for us every night. Well, if there are D receptors there...